The state's been really helpful. I really want to give a shout out to CalEConnect for all that they've done. Come into our community building meetings and help explain to groups, providers that don't know what's going on in the state, sort of give them the national and state perspective. That's been really helpful, and continuing to be able to do that in the new role with UC Davis, whatever entity they end up forming, being able to still send people out to go on these tours with local community HIEs to help, build the trust framework is going to be really important. Also, helping us break down the barriers between private and community HIEs is going to be really important. We can't let it become two parallel tracks or two sequestered sets of systems. They have to be integrative. And that doesn't mean we need to bully the the private HIEs or force something down their throats that they don't want, but the state needs to be able to be a mediator in a world that's becoming increasingly competitive and increasingly exclusionary.
There's a number of things that the state can do to help encourage and enable and accelerate health information exchange. Probably the biggest are model agreements for health information exchange, because when each individual entity needs to negotiate and draw up separate custom contracts with each other, it's very time intensive and very expensive. So that's probably the biggest thing. Second on our minds is to get a statewide consent policy that is reasonable and can be implemented and understood by the doctors and their staff, and that protects the data and the patient's data, but is also one that allows data to flow to improve patient care.
And in some ways, I think California is a great microcosm of what we see across the nation, where you have certain areas with very robust capabilities and other areas with virtually nothing. So one of the key roles that the grants can play is to even the playing field by extending exchange services into rural areas and providers that really lack the capability to do it themselves. Also to jumpstart, if there's existing private exchange or public community-based exchange effort, to support those efforts by giving them funding to expand their capabilities and extend to other people. And then finally, really supporting the critical reporting needs of the state's public health, quality measurement, immunization registries, all the different work where states need to be in communication with providers. I see those as three really critical areas of investment for a state like California.
The broader role of the agency in terms of continuing to set the policy agenda as it relates to the adoption of telehealth, and in our case specifically telemedicine in the state, and continuing to address the issues of how do we serve the underserved, how do we begin addressing some of the Medi-Cal and uninsured patient reimbursement issues for those activities. I think those are the most important things that we see, and then also making sure that all of the statewide organizations, whether it's the California Telehealth Network or CalHIPSO or CalEConnect, that we're working in concert together, that we're actually working in a manner where our respective efforts are complementary and not conflicting with each other, and I think that's important.
I definitely think that the state entity needs to concentrate on continuing to engage the vendors and continue to converge and find a common ground so that the vendors can work together to develop this kit or these tools that will allow the data to flow freely between disparate systems. That's the key. Everybody likes to talk about interoperability and all these key phrases, but it's very, very difficult with the business processes and the business models that have been in place for the last 50 years require that the consumer remains siloed within a particular product. So I think that's the state's, I think that's going to be the big thing that's going to have to occur before we're really going to be able to, exchange that data and get a complete patient record.
One of the outliers that we continue to have is with some of the data exchange agreements. And so within the state of California, there is a gap with the exchange agreements, since we need to have them standardized across the multiple entities that need to be able to sign to be able to exchange the data. So we're looking for the state to be able to provide that, to fill that gap, and also at the legislative level with CalHIPSO Connect and some of the other entities that really do have influence within the Assembly to be able to provide some sort of governance and some sort of guidance legally to be able to help the entire HIE initiative.
Having the support of the state from the perspective of connectivity between the various entities. So helping us, for example, connect to Beacon in San Diego, helping us to connect to OCPRHIO in Orange County. We're onboarding now with the Nationwide Health Information Network. We're accepted and are in the onboarding process, but that's not enough. We could use some assistance around helping us develop those standard connectivity protocols and building a mechanism for us to do that. So that's the politically correct answer. The politically incorrect answer is, don't get in our way. Don't slow us down. We have a model. We have a strategy that so far is successful. Don't hinder our strategy by introducing a ton of legislation or a ton of new requirements that are going to hinder our ability to develop and grow.
I think where a real role and opportunity we all have is helping providers and vendors start to have conversations around standardization. One of my recommendations for conversations at the state level is, how do we use our purchase power to have vendors start to commit to the standards that are set for exchange in these pilot areas. At CalHIPSO, we have 10 local extension centers. And so we know we have learning collaboratives that scale the state. We have 10 sites that are just focused on health information technology. But adding dollars in there where vendors could make the point stronger to them to share that functionality so that exchange becomes a standard and not a request, I think is our biggest opportunity in California.
I think the state can help our efforts by aligning policies and legislation that support the exchange of data. I think that also includes aligning legislation and policies that support reimbursement and incentives to support that exchange of data. And I think they're already doing something now, which is they're providing infrastructure support and funds to help those entities throughout the state build that infrastructure to support data exchange. I think those are the three big things.